If you've ever stood at the bottom of a staircase and hesitated, not because you were tired, but because you weren't sure your knees, balance, or strength could handle it, you're not alone. Climbing stairs becomes one of the earliest physical challenges we notice after 60. It starts subtly, maybe a little knee ache or feeling winded more quickly, but over time it can snowball into fear of falling, avoiding certain buildings, or even needing assistance for just a few steps. And yet, here's the surprising truth. It's usually not because of age alone. In fact, most seniors could regain stair climbing confidence with just 5 specific exercises. These aren't random moves from a gym brochure. They're recommended by orthopedic surgeons and used in physical therapy programs for seniors recovering from knee, hip, and balance issues. If you can carve out 10 minutes a day, you can retrain your body to climb stairs with ease again. And it all starts right here. At major medical centers like the Cleveland Clinic and Mayo Clinic, doctors treating seniors with mobility issues see the same pattern again and again. It's not just about weak legs. Stair climbing is actually a full-body neuromuscular task involving your ankles, knees, hips, core, and even your brain's sense of balance. And with age, small declines in coordination, joint mobility, and specific muscle strength quietly add up. According to Dr. Michael Stair, an orthopedic surgeon at Johns Hopkins, most older adults unknowingly stop activating key stabilizing muscles in their hips and ankles. Over time, this leads to what he calls compensated walking, where your body works around its weaknesses instead of fixing them. That's why traditional walking or treadmill work isn't enough. You need targeted movements that retrain how your muscles fire together. The 5 exercises in this video aren't just helpful. They're the same techniques used in post-surgery rehab to restore natural stair climbing ability. And the best part? You don't need fancy equipment or a gym, just your body, a chair, and a little consistency. Exercise number 5, the ankle awakener. Here's where most people get it wrong. When stair climbing starts to feel harder, they immediately blame their knees or thighs. But studies from the American Academy of Orthopedic Surgeons have shown that limited ankle mobility is one of the hidden reasons seniors lose their confidence on stairs. With every step, your ankle needs to flex and stabilize your entire body weight. But after 60, the ankle joint tends to stiffen, especially if you've spent years in stiff shoes or avoided uneven ground. This loss of flexibility forces your knees and hips to overcompensate, and that's where the pain starts creeping in. The ankle awakener is a simple yet surprisingly powerful exercise. You sit in a chair, extend one leg, and slowly trace the alphabet in the air with your toes. This controlled motion works through every plane of ankle mobility: dorsiflexion, plantar flexion, inversion, and eversion. It doesn't feel like much at first, but after a week, many seniors notice better balance, quicker foot reactions, and even less knee discomfort on stairs. Physical therapists love it because it not only improves mobility, but also wakes up the nerve signals that help you feel where your feet are, a skill known as proprioception. Think of it as updating the software that tells your brain how to move your legs with confidence, and it all starts from the ground up with your ankles. Exercise number 4, chair eccentric squats. Most people think going upstairs is the hard part, but surgeons and physical therapists will tell you the real challenge, especially for aging knees, is actually going down. Why? Because descending stairs requires controlled eccentric strength. That means your muscles need to lengthen under tension, which puts far more stress on joints than most realize. According to a study published in the Journal of Orthopedic Research, older adults with knee osteoarthritis show significant weakness in eccentric control, making stair descent one of the leading causes of falls. This is where the chair eccentric squat becomes a game changer. It looks simple. You slowly lower yourself onto a chair, taking at least 5 seconds to sit down without plopping. But don't let the simplicity fool you. That slow descent trains your quadriceps, hamstrings, and glutes to absorb force gently, the exact motion you need when stepping down a stair without jarring your knees. What makes this exercise surgeon approved is its safety profile. Unlike deep squats or lunges, which can aggravate aging joints, chair squats allow you to control the range of motion and protect your knees. The key is to use no hands. Keep your knees aligned over your toes and resist the urge to rush. Over time, this movement not only strengthens your legs, but also builds the kind of muscular control that prevents slips and stumbles on the staircase. And here's something fascinating. Patients recovering from knee replacement surgery often start with this exact drill. It rebuilds confidence from the ground up, one slow, steady rep at a time. Exercise number 3, step-ups with a twist. Most people are familiar with basic step-ups, placing one foot on a low step and lifting yourself up. But while that move is good for strength, it's not the full story when it comes to mastering stairs in real life. Climbing stairs doesn't just require going up and down. It also challenges your balance, coordination, and rotational control. That's why many physical therapists now recommend a modified version, step-ups with a twist. And no, we're not talking about a dance move. This is a deliberate, surgeon-approved upgrade. Here's how it works. As you step up onto a stair or sturdy platform, you gently rotate your upper body toward the leg that's stepping up. This slight twist activates deeper stabilizing muscles in your core, hips, and spine, areas that often weaken with age, but are critical for preventing falls. According to research from the Gait and Posture Journal, adding rotational movement increases joint proprioception and challenges the vestibular system, which controls your balance and spatial awareness. Why does this matter? Because in real life, we rarely move in straight lines. We turn, pivot, and adjust our footing, especially on stairs with railings, corners, or poor lighting. This exercise prepares your body for exactly those moments. And here's the added bonus. It strengthens the gluteus medius, a small hip muscle that plays a big role in stabilizing the pelvis. When this muscle is weak, you're more likely to wobble or misstep. Start with a low platform, move slowly, and focus on control, not speed. If balance is an issue, keep a chair or wall nearby for support. Just a few reps a day can lead to better stair performance and more confidence every time you take that first step. Exercise number 2, glute bridge marches. Most seniors don't realize how quickly the glutes, the large muscles in your backside, weaken with age. It happens so gradually that you might not notice until simple tasks like climbing stairs, standing from a chair, or walking uphill start feeling harder. But here's what the research shows. Weakened glutes are one of the primary reasons older adults start relying too heavily on their knees and quads, leading to strain, imbalance, and falls. The good news? You can reawaken these powerful muscles with a deceptively simple move, the glute bridge march. This exercise starts with a standard glute bridge, lying on your back, knees bent, feet flat, and lifting your hips toward the ceiling. But the real magic happens when you add the march. From the bridge position, you lift one foot off the floor, just a few inches, and hold it for a second before switching legs. This alternating motion challenges your core, hips, and glutes in a way that mimics real-world stair climbing. According to physical therapy protocols from the Hospital for Special Surgery in New York, glute bridge marches are especially effective at re-engaging the posterior chain, that's your glutes, hamstrings, and lower back, which most people neglect as they age. It also improves pelvic stability, which is critical for balance on stairs. If your pelvis wobbles with each step, your risk of missteps and falls increases dramatically. You don't need any equipment, and you can modify it by lifting your hips lower or keeping your hands on the ground for extra support. What matters is the control. If you can hold each march for 2 seconds without letting your hips drop, you're already ahead of the curve. With just a few sets each day, many seniors report less knee pain and a noticeable improvement in stair strength within weeks. This might sound like a floor exercise, and it is, but it's directly training your body to power up stairs with less effort and more stability, and that's the kind of strength that truly supports independence. Exercise number 1, climax, wall sit with calf raises. This final exercise might sound simple, But surgeons and physical therapists agree it's one of the most powerful full-body movements for stair mastery. If you've ever tried a wall sit, you know it's a challenge. But add calf raises to the mix, and you're mimicking nearly every muscle action involved in climbing stairs, from your thighs and calves to your ankles and core. It's a compound move that builds endurance, stability, and joint control all at once. Let's break down why this works. When you sit against a wall with your thighs parallel to the ground, you're engaging your quadriceps, the key drivers for lifting your body with each stair. But what's often overlooked is the role of the calves. Every step upward requires a strong push-off from the ball of your foot, driven by your calf muscles. And in aging adults, this toe push is one of the first things to fade. Now, when you add a calf raise, lifting your heels off the ground while holding the wall sit, you activate your gastrocnemius and soleus muscles, which are essential for propelling you upward. According to the Journal of Applied Physiology, combined quad and calf training improves vertical movement in older adults more effectively than isolated exercises. There's another hidden benefit too. The wall sit position engages your core and forces your spine into proper alignment. That means better posture and improved neuromuscular control, both of which are crucial for balance. You're not just getting stronger, you're retraining your brain and body to move in sync again. If you're new to this, start with a shallow wall sit, maybe 45 degrees instead of full 90, and lift your heels one at a time. Over time, as your strength builds, hold the position longer and raise both heels together. Just 30 seconds a day can lead to noticeable changes in how you move, and more importantly, how confident you feel walking up a flight of stairs without hesitation. The truth is, stair climbing is more than just a test of strength. It's a reflection of how well your body's moving parts are working together, from your feet and ankles all the way up to your hips and core. That's why these 5 exercises are so effective. They don't just build muscle, they retrain your body to move in a coordinated, powerful, and safe way. The way it used to when climbing stairs was second nature. You might have noticed that none of these moves involve heavy weights or fancy equipment. That's not by accident. Research from senior rehabilitation programs shows that functional strength, the kind that helps you live independently, comes from consistency, not complexity. 10 minutes a day with these exercises is often enough to start seeing real change, not just in how strong you feel, but in how confidently you approach everyday tasks that used to feel risky. And here's the part most people overlook. The brain plays a huge role. As you practice these movements, you're rewiring your neuromuscular system. That means quicker reactions, better balance, and fewer missteps, even when you're distracted or carrying groceries up the stairs. You don't need to be a fitness expert to reclaim this ability. You just need a small daily routine, a bit of patience, and a belief that it's possible, because it absolutely is. And it starts with these 5 simple surgeon-approved steps. Comment your age and subscribe for more senior health tips.